We have what they call the Healthcare Initiative, or Obamacare, some call it. There is a problem with healthcare in America, and we all know that 2,700 pages plus to create some sort of Bible, if you will, on trying to fix healthcare really isn't the answer, but some of the pages were left blank. How do we get healthcare reform in America? And you're first.
We have the best healthcare in the world. In those countries, there's a lot of Canadians that live in Pinell County. In fact, my next door neighbor bought the house that was foreclosed on and bought it for half the price. And they said, you've got the best healthcare, and we have to wait months and months and months for serious surgeries that are life-threatening, and we come here to America, and it's taken care of in a matter of weeks, if not a month. Our healthcare is not broken. The fact that we have a president and a Congress that wanted to socialize medicine, this is the wrong path. It's against who we are. We've got to stop, repeal Obamacare, and we have to put private sector forces to bear on healthcare. Talk about, how about an actual voucher for those that are receiving public assistance, that they can go out there and through free market forces reduce the size because there's transparency in pricing, that you can buy and purchase across state lines, that if you're small businesses, you can pool your resources together and purchase those at a reduced price because of bulk purchasing. And tort reform. There's some real initiatives offered by many members of Congress. This isn't rocket science. You don't have to be an economist to figure this out, but that's what needs to happen here. Not what else is wrong with in America and what can the federal government can do to fix it. Stay the heck out of the private sector. Stop bailing out banks. Stop bailing out the auto industry. Stop saying that there's a role for everything in the federal government. If it's not enumerated in our Constitution, it falls to the states. And the federal government has become far overreaching, and this is the signature of Obama and the strength of this federal government that must be stopped.
The real solution to this is we need to move from employer-provided health care and government-provided health care into a system where you own your own health care. In reality, your boss really doesn't want to be involved in your health care. They would much rather write a check for what they're spending on your health care, give that to you, and let you buy your own health care. You need to move the young people into this kind of a system now, so that with a healthcare savings account, so that they can amass money in that account, so when they get older and when they have more issues, that they'll be able to have the money to address those issues. That's what you really need to do, because we've essentially created a system where the free market no longer applies in medicine. You know, the doctor's got the attorney chasing him, your boss has got the insurance company chasing him, and you go to the doctor and you don't care because you don't pay. When we do those kind of things, it gets us away from a free market system. If that was your money, you would be darn sure that you didn't get overbilled. If that was your money, you wouldn't be paying $12 for an aspirin. If everybody acted like my wife did when we didn't have maternity insurance on our third child, we would have a very efficient medical system, because my wife went out to bid for her OB doctor. We had the existing doctor. She went around, and since we were going to pay with this for our own money, she actually went and got quotes from other doctors. And it ended up she got a price from a doctor. She then went back to her OB doc and negotiated a better deal. If we all behaved like that, we wouldn't have this issue. And that's what we need to do. We need to get back to a position where I own my health care. I'm responsible for me. If my employer is going to contribute, he would pay me a check that I would put in that account. That's how we solve this problem. It took us 100 years to get into this. It'll take us time to get out of it. But that's what we really need to do, and that's what makes the free market work.
I'm the only member on the stage that repeatedly voted against Obamacare. Voted to repeal it. Voted to repeal the IPAP board. 15 unelected bureaucrats who decide what kind of treatment you're going to get. I've also stepped forward with ideas that will go along with Paul Ryan. One is to increase the competition. And so just when we repealed the IPAP board, we actually took on the insurance companies. Yes, the dentist actually took on the insurance companies. To make sure that what we did is had free markets, actually empowering us so that we have the opportunity for them to build a patient-centered healthcare system. We also have to take on public health because they've gone astray. They answer to you, and your district and now our city is a little bit different than Sun City West, which may be a little bit different than in Navajo Nation. And last but not least, tort reform. Oh, by the way, the thing that I snuck in on the iPad board is actually class action tort reform, which is what the insurances needed to actually come into the play to have more competition. Actually, the dentist did.